when I talk to all the allied health, I told them about aging and aging with a disability. Because if they can understand what aging is doing, what aging with a disability does, they will understand how to treat you. Equally, you must understand what aging is doing to your muscles. So that's why this is a very dry, very boring talk. So when did it all start? Okay, so your problems, when did it start? Yes, you had polio, but late effects. There is a point in time where late effects starts to happen. Unfortunately, it starts earlier than you feel it. But you as clients will feel it only where there's a functional disability. That means now I'm finding it hard to stand up. I'm finding it hard to walk. You're not picking up the slow. So where it starts is where it's a functional limitation, meaning you're struggling to get out of a chair, you're struggling to stand and brush your teeth, you're struggling to stand and cook, or you're struggling even to stand in a queue in the post office or in the shopping center. So functional. Research has shown, and there's a lot, these articles I've sent to all the physio colleagues now. I told them, read, this is very important. It is, when does it start? It starts with deconditioning, meaning you are not fit. And what does not fit do? What being not fit does is it decreases your aerobic capacity, meaning the ability of your muscles to use oxygen. Once that happens, it's a downhill slide. Why isn't it? It decreases mobility. The blank for some reason didn't come up. It decreases mobility. So once you decrease aerobic capacity, the ability to use oxygen, you start losing your ability to move your limbs, stand on your limbs. Then if you start having difficulty moving, you are going to increase your fatigue because you're not moving enough. You're not moving enough to keep fit. Now that once you've increased fatigue, it has a flow onto what I call decreased functional mobility, meaning getting out of bed is hard. Walking to the toilet is very hard. It's too tiring, so you stay in bed longer. It's too hard to stand and cook, so you don't cook, you take away. So it has a downhill effect on your functional mobility, meaning your ability to look after yourself at home because you're so tired. Once you do that, once you start doing less and less at home, now you decrease your pain threshold. This is research. Okay? This is research at a cell level. So you can say I don't believe it, but unfortunately it will happen. Whether you believe it or not, as night follows day, it happens. So decreased pain threshold means everything starts to hurt. Even a small problem is very painful. Once you do that, you all know this, decreased sleep. Okay? Once you have not enough sleep, you have a decreased quality of life. Decreased sleep also affects everything else. It affects your strength, it affects pain, it affects your heart, it affects your brain. Okay? You're opening yourself up to a lot more problems once you have decreased sleep pattern. Now you have decreased quality of life. And because of that, you've now the full cycle. You're now closing the cycle of deconditioning. It's self-perpetuating. Can I beg you, don't worry about writing it down. It's all on your website. I'm leaving all of this information here in New Zealand. Okay? And Anne has it, and if she hasn't put it on the website, ask her to. Stay on her back. Okay. So this is what happens this is where it all starts. It starts with the functional limitation, meaning you start struggling to do what you could do 2 years ago, 3 years ago. And once you start, and why do you get functional limitation? It starts with a little bit of deconditioning. Deconditioning, which is you are not using oxygen in your muscles. Therefore, you're not doing what you could do 2 or 3 years ago. So that's where it starts. Now let's go to normal aging. This is across the board. Whether you're walking, whether you had polio or not, it happens to every one of us. The impact of normal aging process on skeletal muscles, that the muscles of your body and your joints, can have profound effect on the functionality of an individual. Meaning, normal aging of your muscles and joints will limit what you can and cannot do. It's obvious. Everyone says you're getting old. GP has said that. Every GP goes to, well, you're getting old. Okay, so accept that. No, you don't have to, because as we go through, we can see how we can turn that around. More importantly, aging with a disability adds a greater burden to the client and society, and is a more urgent need, especially from late adult years into middle and beyond. That means that it is more expensive to look after someone who's disabled than to look after him when he's able. Okay? So that's the key. This is why my soapbox is a late effects clinic. And in a late effects clinic, I'm pushing all late effects. Anyone who's born with a disability, who acquires a disability or who is 10 years post a stroke or an amputation. Everyone is going to go through the same thing every one of you is facing. In other words, polio is the first cab off the rank. Behind you follow everybody. The cerebral palsy client who's sitting in a wheelchair at 19 is facing the same problem you are facing because he was born with it. So his aging is much faster. That's what James Rimmer is saying, and it's so true. I've got 700 patients on my Late Effects clinic books, 500 polios, and about 200 others, meaning spina bifida, all those there. Now, so that's my bona fide. I do know what I'm talking about, in other words. Having said that, I will defend my colleagues. They all know what I'm saying, but they don't see enough of you. Because every one of you is different. So really, each physiotherapist has to see at least 20 polio, late effects polio, to understand how it impacts differently. Then only will she understand what's the best treatment for you, individualized treatment. For that reason, I've been trying to sell this idea of getting all of you towards 1 or 2 physio only. All right, not 20 physios, because then you dilute the effect. Go to 1 or 2, let them acquire the depth of experience required. I will link with them, email, video conferencing. These are easy ways. I don't have to come back. I can video conference with them. I can email them. They will know we speak the language. And it's actually very simple. They just need to see enough of you. Same with the orthotist. One orthotist must see enough of you to understand that this caliper he gave you was too heavy, it actually made you worse, or why this caliper he gave you should have been effective, but it made you fall. He's not going to know that unless he sees enough of you. Again, for the same thing, I would encourage you all there are a number of orthotists also who signed up, and Anne has got the address to go through. So let's go on with this. Age-related changes in muscles and joints, the aging program. There's 2 theories on it. One is called a program theory, following a genetic timetable. That means your genes are programmed to age. That, I think, most people sort of, that's why they give the very fatalistic, outlook. We'll get older, we'll get downhill, be happy, sit in a wheelchair. Okay? That's a very fatalistic, and that's going on this program theory. The other one is a damage theory, saying cumulative consequence of free radicals, meaning there are toxic substances in the environment. There are toxic substances as a byproduct of every cell in your body. For example, the most obvious, if you have diabetes, if you have high cholesterol, if you have high blood pressure, your cells are working at an abnormal, trying to get back to normal. In that process, they are actually releasing a lot of toxic substances into your system. That's causing aging. And I think, obviously, all of you will agree, it's probably a combination. It's not one or the other. It's probably a combination. So the more healthy you are, the better you can look after yourself. That's the point. Okay? And then we have to input into that program. Now, before we go any further, to understand a muscle, you must understand some aspect of science. All of us, every muscle in our body, whether you're walking or not walking, you have something called a slow twitch muscle, which is a long-acting type muscle. It's called type 1. It depends on aerobic, meaning it depends on oxygen. It is used largely for endurance activities like walking. It needs more. Mitochondria are the little cells in your body that give you energy. It needs more of those cells. It needs more protein in your blood. It needs more blood per square inch of muscle. So endurance means you need all those other factors, the mitochondria, the protein, and circulations. Space. That seems obvious. But you can do something to make it better. Okay? So just because your muscle is wasted doesn't mean you can't make an impact on it. You can. So you need something, you need to impact on your long-acting type 1 muscle. If you forget type 1, think of it as endurance muscle. For any walking you do is your type 1. There's something called a fast twitch muscle, which is your short-acting muscle. Any of you with calipers, you are using a lot of fast twitch because your endurance muscle can't lift your caliper and swing it quickly. It's your slow twitch muscle. They are short-acting. They can only work for a little while, and then they fade out. They are otherwise called type 2 muscles, so you've got type 1, type 2. Type 2 short-acting, it can derive energy for periods of time from anaerobic. That means if oxygen fades out, the type 2 can work on less oxygen. And this less oxygen is what runners use. We train our athletes, including disabled athletes, to the point of where they actually vomit, and then we keep them training. Okay? So they are training them to use the anaerobic. It doesn't work for polio. Across the board, if you go into this anaerobic cycle, that is anaerobic means no oxygen cycle, you will lose strength, which is why any one of you who has exercised to the point of being tired or painful, you've gone worse. And not only worse, it's not just a feeling, you have actually you caused loss of muscle fiber. Not only loss of muscle fiber, you've also caused a loss of nerve to your muscle. You have damaged your muscle bioactivity. So therefore, you need to understand the word aerobic very, very clearly. In your mind, you must understand what it means and what it implies. So the fast twitch muscle, obviously, are your running muscles or your fast walking muscles. Now, so the reality as we know it, in the normal aging process, the geriatric population, skeletal muscle changes are related to aging. That means your muscles change because of age. Inactivity, you're sitting around not using the muscle. Underlying medical conditions, high blood pressure, cholesterol, early Parkinson's, if you've had a stroke, so rheumatoid arthritis, polymyalgia, any medical condition that adds to the aging process. Poor nutrition, you're too tired to go and cook for yourself, so you take whatever comes off the shelf. And that has a huge impact now. Nutrition, poor nutrition puts on weight as much as it also has a negative effect on your skeletal muscles for other reasons. Okay? And hormone changes, they have a huge impact on your... So this is normal aging. This is what you're faced with. Age-related changes vary among muscle groups and muscle fiber types and do not affect all muscles equally. Now remember I talked about your endurance muscle and your fast-acting muscle. Okay? So aging changes has an effect on those two muscles in a different way. So it doesn't affect everything equally. So you need to understand that also. So it's not your fault. Up to this point, I keep saying, remember, it is not your fault. It is part and parcel of aging. But what you need to understand is, on top of this aging, put another 20 years. You're almost 20 years older than colleagues of same age. Okay? Because you're working that much harder, you're burning. For that reason is why you must understand this boring subject of what is my muscle? What is it in my body that causes all these problems? Okay, the reality as we know it, in normal aging, muscle mass decreases with aging. For example, in terms of total body weight, a young healthy person, this is around 25, 30% of somebody when you were young, you had 30%, each one of you, say for example, I'll take it to you. You had 30% of your body consisting of muscle, okay, when you were 25, 30, and 20% of it was fat. By the age of 75, it's only 15% muscle. That means you only have half the muscle mass, the quantity of muscle that you had when you were 30. Of course, you can't do the things you could do before. That's why you can't. And you have double the fat, 40% more fat, just by normal aging. Okay? So therefore, you have to do something with knowledge to try and change this. You can't change it. So normal aging is against you. There's strength decline at roughly maximum 2% between age of 65 and 89. 2% every year in normal aging. So if you already have lost muscle, if you have polio paralysis, remember this, yeah? And if you have a weak muscle, your weak muscle is aging at 2% every year. Power is the ability to generate strength and time. So to be able to lift a weight quickly or go up a slope, go up a step, all of those are power actions. That declines by 3.5% from 65 onwards. Okay? This is normal aging. Now, unfortunately, there is more. Maximum isometric force decreases by 20%, meaning how much strength I have to maintain. So if I'm lifting a bucket of water, 5-liter bucket, how long can I hang on to it? That's the isometric force. The ability to do that decreases by 20% by the time you hit 60 and by 50% by the time you hit 80. Okay? You have to do, in other words, you have to do more the older you are, and you can hold it. Because that's the critical age for independence. You're hitting 75, you're hitting 80, that's when you are worried about, am I going to lose my independence in my home? Please start when you're earlier. Those of you who are younger, start earlier, it is not so hard. The later you go, it is harder for us to turn it around, but we can, at best, at least hold you where you are now. If we can't turn you around, we can hold you. For those who are 50s and 60s, we can turn you around. But you've got to do something with knowledge. 70s and 80s, by 70s and 80s, maximum voluntary contractile strength decreases by 20 to 40. And what determines that is how big your muscle is. Not age, not gender, how big your muscle is determines how much force you can actually exert to lift that 4-liter bucket. Okay? So I could do it all my life is not something you should hang on to, because you will tear a muscle fiber. I've heard stories, I tore a muscle, that's why. Okay? And you will always tear, not because you're lifting a 20-liter bucket, because you know it's 20 liters, you're taking extra care. It's when you go to put it down, that's when you actually, because a muscle that does that can actually exert greater force. But exactly why you tear here. As soon as you put something down, you tear. Could be even a cup of coffee. It's just that you reached a little bit too far and you tore a muscle. Bing. No doctor is going to go back and sew it down. Remember that. You're too old for that. Okay? It'll actually cause more problems. So therefore, look after what you have. Aging muscle. For some reason, I didn't put the slide up. There's another slide I should have added here. That in polio, it is known. You may have polio in your big toe. Doesn't matter where. You lose strength in your upper limbs by 17%. Whereas the normal population loses it at the max 3%. Right? Normal aging, 3%. For all polio, 17%. Can you see how you've got a massive red card in your arms? Whether you had polio in your arms does not matter. You are going to lose strength at 17% annually. So again, you are independent in the home. Ma'am, you said it. You are independent in the home because of your arms, not because of your legs. Okay? You can always go to the hairdresser to wash your hair. You can get takeaway. Who's going to bathe you? Who's going to touch your body to personal care? Who's going to do that? Without your arms, you can't do that. So again and again, for every one of you who's using a caliper, every one of us who's using a stick or an elbow crutch, think very carefully. Preserve your strength. Use a better aid. I'll touch on all those subjects in the subsequent lectures, but it is important to preserve shoulders. That's your priority right across the board because of that 17% problem. Aging muscle, there's reduction in size and total number of fast twitch. So as a muscle ages, normal aging, for some reason you actually lose the size of your quick muscles, so it shrinks smaller, and also the muscles that give you the ability to stay still, the endurance muscle. Okay? Aging just makes it smaller. You can't stop it. You can do something to turn it around, but you can't stop that process. There's another theory called, it's not theory, it's been proven, something called motor unit remodeling, which means this is a process by which there's a selective denervation, that is, nerves going to a muscle actually selectively die because you're not using the muscle. If you don't use the muscle, the nerve doesn't grow. Okay? And if the nerve doesn't grow, the muscle dies. Okay? That's what's called selective remodeling. Because often, in many muscles that are like your muscles, polio muscles, you acquired strength by something called sprouting. Okay? And I'll go through that in the next slide. What happens is those sprouting nerves start to die very quickly. So this is the theory for something called motor unit remodeling in aging, in normal aging. Okay? Now what happens in polio? All right. That was presented in the Asia Pacific Conference by this group, and this very nice series of slides. If you can understand it, I've given it to Annie to send to the physios. The first section, section A, shows you anterior horn cell. Your polio attacked only that part of the spinal cord. Okay? It attacked the spinal cord. Polio selectively attacked the anterior horn cell. And Dr. Liz, it's unfortunately in the brainstem, I think many of us forget, the cranial nerves, the 12 cranial nerves, they're actually anterior horn cells because they are the last interneuron, which is why the brainstem, many of you have bulbar palsy. So you think it's central, whereas brainstem is central nervous system. It is not. It is actually the anterior horn cell, so the last interneuron. Now, for an example that 3 nerves supply 1 muscle. What happened in polio is the slide B. In polio at onset, polio attacked the anterior horn cell knocked out 2 of those nerves. You are never going to get those nerves back, but only one nerve survived, right? 8 years, roughly, due to functional recovery. I'm not sure if they can see the red. Okay, the red bits are what they call the sprouting. Because of recovery, natural recovery, sprouting occurred. So the one remaining nerve started to touch extra muscles, so therefore it doubled and tripled its workload. As you got older, somewhere from 8 to 35, you went to work, you did whatever you had to do, you ran, many of them were farmers who worked really hard to build muscle up. Well, how you built up the strength was more sprouting, so more red, the bigger one, yeah, that one, more red. So now what happens in late effects is those red bits start to die back. That is why you feel as if you have the same weakness you had when you had polio, because you are now left with what you had originally. Now that sprouting is aging effects, okay? Sorry, the dying back is aging. No, why? Because you've burnt up the nerve. You've burnt up your muscle. It's too hard because aging is setting in and you are trying to push yourself without doing anything extra. It's like a bank balance, you know. When you were young, your bank balance was up to that third slide. Okay, that's your bank balance, positive. After that, you just drew. Okay, you just drew on your bank balance. Now you're left with 0. Unless you put something back, you're going to go downhill. I can honestly say that. It'll happen. Okay? It may happen in 5-year cycles or 3-year cycles, but it will happen. So please understand the reason for all of this expensive venture here. I'm a very expensive person to look after. Is to tell you, do something now. Okay? Whatever age you are, you can stop it by doing something with understanding. Further, so what's the pathophysiology is what happens at a cell level. Okay? I've talked to you about fast twitch, slow twitch, normal aging percentage. All of that is sort of a global picture. There's problems happening. Why all of that happens is at a cell level in your muscle, you're losing something called satellite cells with aging, meaning these are the cells that repair your muscle. That was long ago when I went through physio and beyond, those before. We were told you can't repair muscles, you can't repair brain cells. Apparently now the modern research says no, you can. Okay, there are things that do repair the brain cells. That there are cells that repair muscles. Now, the cells in your body that repair muscles have this lovely name called satellite cells. And normal aging, for some reason, it starts to collapse. Okay? You have less and less. And what reduces it is overload. See that word, injury and overload? Okay? Even if you say, I have not injured myself, how many of you cannot say that you've not overloaded your muscle? Okay? Every time you walk abnormally, you're flicking your body around and, oh yes, I can walk. And you're starting to do that, you are overloading the muscle. I don't want to use a stick. I don't want to get old. Come on. You are fantastic personalities. Your personality is not the stick. So this is what I'm fighting with when I see my patient. I don't want to look old. I said, if at 60 you're saying a walking stick makes you look old, where's the personality? Now you are a magnificent personality. So please understand you are who you are because of what you are, not the stick. The stick doesn't make you a person. Reduce oxidative capacity in the mitochondria. Now that's normal aging by 50% of volume. That means mitochondria is your energy cells. Everyone who ages by 50% of volume in older adults. Older adults is now hitting 60. Young adult is 40 to 50. Okay? From 60 onwards, you have 50% less volume of mitochondria, which is why you all feel fatigue. Tiredness happens because you are losing mitochondria naturally. If you now force yourself to go beyond your capacity, if you're not pacing yourself, you're losing more than 50%. And that's the point I'm trying to make. There's decreased rate of protein synthesis due to, this is very technical, reduced protein in amino acids. Now that basically means your body cannot produce enough protein to build the muscle. So even if you have the right exercise, you still have to have enough protein in your body to build the muscle. Okay? Now that protein, there is all 2 things that's affected by the type of food you eat and also the ability of your body to use that food to build muscle. Okay? Now that process reduces naturally. And understand, every time I say naturally, add a 20% more to every one of your muscles. And it's not just one muscle in your leg. Every muscle in your body is going through this process. Further, impaired calcium ion uptake reduces membrane permeability, meaning calcium cannot get in and out of your cells, and what that does, it decreases the ability of your muscles to actually tighten. To have that strength, your muscles must contract. If you don't have enough calcium, the muscle cannot contract because the signals are not going in and out of the cell. So that's what it means. So that is why now you know why you not only lose strength, you also lose the speed to get a contraction. So you're slow in getting out of the chair. Can't do anything fast. There's reduced motor unit firing. As subsequent to that, there's associated increased presence of fibrotic tissue, impaired healing of injured muscle, and increased fatigability. Now, just rewording that, it means every one of you who has said, I've got a painful shoulder, painful hip, painful knee, understand there's fibrosis in your muscle. Okay? And as long as and I don't take medicine, I'm fine, I'll work through this. You have fibrosis in the muscle. If you have fibrosis in the muscle, the nerve, even if it's intact, cannot fire through that fibrosis. It needs normal muscle to fire. The nerve needs normal muscle contact. It will not function if it hits an area of what we call fibrosis. Because of that, the nerve dies, and then subsequently the muscle dies. So can you see that every time you have pain, you are increasing your weakness and you are damaging your nerves. So you've got to look after that. And the result of that is not only are you more tired in every muscle, your heart, cardiovascularly, all of you are very fit. If I compare you to your age group, cardiovascular, the ability of your heart to recover is way beyond your counterparts. You're saying normal age counterparts. But your muscle endurance, every muscle in your body tires 20 times faster than your normal age colleagues. In men, hormonal changes, this is what's recorded. Decreased testosterone in men is associated with decreased whole body protein anabolism. That is, your body in men cannot work to increase the muscle mass. Okay? It cannot process the protein to make your muscles bigger because you have the decrease in testosterone. So you need that checked. You need to increase that to make sure that you are getting best out of your exercise program. And also, decreased testosterone decreases the ability of your body to metabolize fat. So you stack on the fat. So in other words, go to your GP because there is a hormone deficiency in you. You need to address that balance. In women, there is loss of estrogen, decrease in estrogen. We all know of that. 15% decline in muscle strength around menopause, so 50. By the time you hit 50, because of less estrogen, you're 15%. Put on top of that normal aging, put on top of that aging with polio, aging with a disability, okay? So can you see how your red card, you've got more and more red cards in your hand now. Every one of these statements is a red card. You've now already collected about 10 or 15 in your hand. And what does all of this mean? All of this translates as impaired gait, impaired walking ability, impaired balance, higher risk of falls, and you keep falling, there's no such thing as I know how to fall. Okay? Please, every time you fall, you've hurt something. You may say, I'm strong enough, you will get up and walk again, but you will fall and you're hurting something. And this, over time, will impact on what you can do at home. And remember the first slide. Decrease in functional mobility starts to have impact on decreasing pain threshold, and then poor quality of life, etc., etc. Okay. So this is at a cell level. Now, do we have to ignore? No, there's more. Unfortunately, there's more coming. Okay. As all of us age. Now, I don't stand here apart from you. All of us. Aging effect also affects organs of your body. Every organ in your body loses some function as it ages. Okay? Let's look at every one of those organs has an impact on balance, by the way, and I'll talk on that in false risk. Cardiopulmonary, that's your heart and lung. Your lung changes in the bones, in cartilage, in elastic structures. So this is, in medical terms, we say you're losing lung compliance. And I just threw those numbers up because it's really are amazing numbers. That between age 25 to age 65, your vital capacity is decreased by 20%. I've heard this, and when we do a vitalograph, you know the breathing machine, you blow into it, forced expiratory volume, I could do 3, 4 liters, 2 years, 20 years ago. Now I can only get up to 3 liters. That's because aging. You're losing lung compliance. If you're smoking, you have double that problem. There is also forced expiratory volume. What that means is how much air can you force out, but you'll always have 10% more left in your lung. So you're holding back 10% just by normal aging between the age of 25 and 65. There's residual volume. Just because the lung doesn't totally collapse, you've got 10%. So now you've got 30%. When you breathe out, there's 30% air that hasn't come out. Okay, what does it all mean? It means you've increased your dead space, meaning there is not enough carbon dioxide oxygen exchange happening in your lung. So you're going to be short of breath. So you've got to be able to breathe in, but more importantly, you've got to be able to breathe everything out for gas exchange to occur. All right. What affects it more? So therefore, the increased work of breathing is loss of alveolar tissue. Now, if you see this diagram here, that little bubbles, that's called alveoli. Those little bubbles become one big sac. All those little partitions go. Okay, now, once those little partitions go, you actually have less surface for oxygen to exchange. Okay? You need more of those bubbles for effective oxygen exchange to make you less breathless. So as you age, you're losing all those little bubbles. So you get one big mass of bubbles. If you smoke, that's what happens. If you have cystic fibrosis, if you have chronic lung, that's what happens. That's why you're so breathless. You're losing all this little alveolar space. More so, you also have changes in muscle structure. The way your muscles are changes with aging. The mucosal bed becomes thicker. So many of you will end up with so what it all means, and the tubular structures, the little bits of tubes, those become more rigid. All that means is, as we age, you know that it's harder to cough and bring something up. So that's a combination of lung compliance and everything getting stiffer. And then on top of that, you have dead space. So you're not breathing everything out, therefore you become breathless. So you walk a little bit, you become breathless. And then when you get a nose cold, it becomes an upper chest cold, you get breathless. Okay? Because of that, because of changes in your lung. Now remember, in polio, again, when you age with a disability, be it polio or cerebral palsy, this becomes worse. Now, on top of this is normal. So we know disease process. There are changes in the heart also. Your heart valves become less elastic. There's less blood flow into the lung. So therefore there's back pressure, which is why it's so hard. You always have wet lungs. Because the back pressure because the heart is not as elastic as it used to be. And then if you have high cholesterol, the heart is not functioning well. If you have myocardial, any sort of heart problems, again, your heart is compromised. What that happens is it puts back pressure on your lung. You get wet lungs, constantly wet. Okay? Part and parcel of normal aging. Then you have things like coronary artery disease or ischemic heart disease. Then you have chronic lung disease. These are disease processes that all of us acquire. They are called co-morbidities in the medical terminology. So you have normal aging, and now you have co-morbidities. Congestive cardiac failure causes significant changes. So it's not just, we only think of congestive cardiac failure in the heart and lung, but it also changes skeletal muscles mitochondria, meaning the energy cells in your muscles are changing because of your congestive cardiac. The changes in what's happening in the heart actually depletes your the energy cells in your muscle. It depletes it. So you become more tired with every activity. So not only are you short of breath, you're actually tired every time you use your muscles. If any of you have had heart problems, you know this. You're just totally exhausted. It's total mental and physical exhaustion. Chronic renal failure, big problem, same problem. The mitochondria again is less and therefore leads to loss of muscle energy. So disease processes, you won't know it, your GP should know it. Okay? Anytime you have a disease process, ask the GP, what is it doing? Okay? So, and all of them have effect on your muscles. Now, the other thing, what we do, in medicine what we do, you're tired, you've got a back pain, go and rest. Lie down in bed. You fracture your bone, you fracture your leg, we get you to hospital, we ask you to rest. What are we doing when we ask you to rest? You now also, besides all the normal aging, because of the rest, you're losing muscle mass, that is size, and strength at a rate of 1.5% per day. Now, it is totally crashing down. Okay? Muscle inactivity increases twitch contraction time. That means your muscles will take longer to tighten. The other two, don't worry what it says, I'll explain that. Pain, what we know in research, what pain does, it switches off your muscles of endurance, the muscles that allow you to stand still, more than it switches off the muscles that make you move fast. Okay? So both muscles, pain, switches off those muscles. Okay? So your slow muscles and fast muscles now are not working because the brain is sending signals to the muscle to say, stop working. So just imagine this. You are in bed, you got a back pain. Or you're in hospital, let's example. You're in hospital either because of fracture or because of extreme back pain. You've been resting in bed, doctor says bed rest, fine. You get up. And what's the first thing we physios say? Please brace yourself. Pull your stomach in and stand still. And you can't because you don't have the muscles. It's easier for you to move. And every time you move, you are firing up your pain. And you can't, so therefore you can't stand still and you can't move because your muscle has been switched off. So what the way around it is, we as physiotherapists, and that's the approach I used when I was giving the lecture. I gave them the same lecture and said, therefore, you can't ask a person who's had polio to just lie in bed. You must give them exercise for the good parts of their body that are still working while they're in bed. And the exercise you must give them is both for the fast muscles and the slow muscles. That needs knowledge. And that's the only part I have to just remind my physiotherapy colleagues about. Okay? Otherwise, we speak the same language. They know exactly what I'm talking about. Now, aging affects your balance and movements. All of you have experienced that. Why? Because your visual, your eye, your somatosensory system, there are pressure sensors in your skin from your big toe right up your body. That is how you know without looking. If you put your hand in your pocket, you know without looking whether it's a 50-cent coin or a 2-cent coin by the pressure centers. But it tells you size and shape. So that decreases your proprioceptors. These are cells in our joints and in our tendons that tell us where you are in space. So without looking at your hand, you know whether your finger is bent. Without looking at your foot, you know whether your toe is bent. That's because proprioceptors are working. So those of you who do not have muscles in your toes, you won't know that. You won't know whether your toe is bent or straight until you actually fallen on it. So that is what we call the somatosensory system. Okay, so this is normal to all of us. The vestibular system is the system in your middle ear. So if you're on a car drive and you get car sick, that's the system that's causing the problem. So that is the system that gives us information about ourselves in space. All of that system, that going inward system, the input system, is aging also. So everything is slowing down. Then the second center that's responsible for balance is our central processing. It increases, there's increase in response time. Your brain doesn't respond as fast. So although the signals are going in, your brain is a bit slower in processing it. Then your output system, so this is all for balance. The motor system is your output. That means your muscles and joints are what we call the effector. That is your working system. So the sensory system is what tells you about what's happening. Your muscles and joints are what you do about it. Okay? There is delay. For the reasons I've already explained in normal aging, put it all together, it's a delayed response. So even though your brain may work fast, by the time your muscle responds, it's too slow. So you've either tripped or fallen. And there's also poor coordination as a result. So you will fall if you have poor coordination, poor strength, and loss of balance. Okay? You will fall. I'll just explain one or two things a bit faster. Central processing. If your brain works fast, you can respond to balance, shift in space. Yeah? As soon as you shift a millimeter, very small, a nanometer even, your brain tells you you're out of alignment. You can come back. But the more you get used to doing this, you are now desensitizing your brain. That's the problem. Okay? So you're not doing yourself any favors by walking. I can walk without holding a stick. Don't be proud of that, because what you're doing is telling your body, I have to go this far before you react to get me back here. You have to tell your body, I have to go this far before I come back. Okay? So please understand this. It's important that you understand this concept of balance. And a delay in postural reaction, so if you're too slow in reacting to come back here, you also have instability in standing and moving. So just because I do this, you don't think of it as only at falls. If I stand, I need to be fast. Okay? And that's why you can do this. Okay? Because what you're doing is constantly stimulating your feedback system, the proprioception. You're stimulating your joints to tell you, what am I doing when I'm standing still? That is why many of you can't stand still. Okay? And I know when you tell me that I can't stand in a shopping queue, I know which muscles now are causing the problem. Okay? It is your endurance muscle. You know the slow-acting muscles? They are tiring out. So you have to move your fast muscles to feed back what you have to do. So, central processing, this is right across in the medical profession. For Alzheimer's and early dementia, we are saying get your brain stimulated with new learning. It's not what you could do before that helps. You have to force your brain to learn something new. And really we encourage people, I think, this iPad, all those things, and doing crosswords, doing mathematical solutions. Mathematics for some reason stimulates the brain more. I'm a very poor mathematician, so I'm already on the back foot. But I'm happy to learn something new. So we encourage all our patients who are complaining of poor balance, learn something new. Even if it's useless, go to the third age, what is it, University of Third Age or whatever. Just learn something useless like archaeology.